Good evening, everyone. So, my next topic of the video, which I'm going to discuss with you, is on the topic pre-drug exercise. And in this pre-drug exercise, I will discuss with you the topic mild hypertension. That is the common disease, mild hypertension, which is seen in most of the population. Now, pre-drug for that, I will choose one case, and then I will discuss with you one case, and then I will discuss the pre-drug, how to choose the pre-drug. And before I start my video, I want to request you if you like this video and if it is helpful to you and if it's useful to you, kindly subscribe to my YouTube channel as Dr. Nitika Pharmacology Discussion. Now I'm going to discuss with you P-drug exercise. Now P-drug, it is the personal choice of the drug or the priority choice of the drug or the preferred drug. What is P-drug concept? It is the personal priority preferred drug. P-drugs are the drugs you have chosen to prescribe regularly and with whom you have become familiar. Means we use this drug regularly and the prescriber has become familiar with this drug. P-drug concept is not just the name of pharmaceutical agent or pharmacological substance, but it also includes the active ingredient plus dosage form, the dose schedule, the duration of treatment. This in P-drug concept, everything comes. That is the active ingredient, then dose, then dosage form, then dosage schedule, and duration of treatment. And this is the priority choice of the drug, personal choice, and the preferred drug. The choice of the P drug, that is step criteria. It is based, it depends upon the following criteria. That is safety. This is how many other possible adverse drug reactions were caused by some drug. We have to see that. We have to see what is the suitability of the tolerability of the patient, efficacy, which is the drug profile, which is the therapeutic response of the drug in the patient, and price. And in the price, we have to look for the total cost of the treatment. Is what is the total cost of the treatment? If the drug is given for 10 days, then we have to not see the cost per unit tablet, but we have to see the total cost of the treatment given during the total duration of the time to treat some disease. The process of choosing drug will be that first of all, we have to define the diagnosis, means what is the P drug and what is the disease the patient is suffering from, what is the indication of the disease the patient is suffering from. Then we have to set them some therapeutic objective with it. And then we have to make inventory of the effective group of the drugs. We have to set the therapeutic objective. And then from the disease, we have to make which all group of drugs are suitable to treat that particular diagnosis. Then we have to choose the effective group from that groups. And then from the effective group chosen, we have to choose the P drug. Now, first of all, I will discuss with you case history 1. A moderately obese 40-year man is diagnosed case of hypertension with blood pressure 146 by 94. Choose an effective P drug. Now the blood pressure is 146 by 94. This is the patient millimeter of mercury. This patient is suffering from stage 1 hypertension. And the age of the patient is 40-year man. 40-year man. So how we have to define the diagnosis? This is the diagnosis of stage 1 hypertension. Therapeutic objective is we have to see the blood pressure goals. First of all, that is the patients who are less than 60 years, the blood pressure should be less than 140 by 90 millimeter of the mercury. And for the older patients, there is stricter, if the patient is greater than 60 years, is less than 60 years, then the goal is 140 by 90 millimeter of mercury. If the patient is greater than 60 years, then the blood pressure is less than 150 by 90. And even the older patient, if suffering from the chronic kidney disease and diabetes, the stricter guideline is that is the 140 by 90 millimeter of mercury should be the blood pressure. Now, therapeutic objective means we have to prevent microvascular and macrovascular complications like ischemic heart disease, renal damage, stroke, peripheral vascular disease, and retinal damage. And we have to maintain the blood pressure less than 140/90 in the younger patients less than 60, and in older patients that is more than 60, the relaxation is there, that is 150/90 millimeter of mercury. The inventory groups, that is, we have to choose are first of all ACE inhibitors, angiotensin converting enzyme inhibitors like captopril, ramipril, angiotensin 1 receptor antagonists like losartan, telmisartan, beta blockers like atenolol and metoprolol, calcium channel blockers like amlodipine, nifedipine, diuretics like hydrochlorothiazide. These are the various groups of the drugs used for the treatment of the mild hypertension. There is ACE inhibitors, beta blockers, calcium channel blockers, and diuretics and angiotensin receptor blockers. Now from the choose the effective group. First of all, ACE inhibitors. These are the most efficacious group of the drug, as well as the patient is less than 55 years of age. So the ACE inhibitors are the drug of choice for the patients less than 55 years of age, and according to new JNC age guidelines. And if the patient is more than 55 years, then calcium channel blockers is the effective group of the drug to be used, first time drug to be used in the treatment of the mild hypertension. Efficacious also because realistic angiotensin converting enzyme, so angiotensin 1 is not converted to angiotensin 2. So there is no vasoconstriction and salt and water retention. And safety-wise also only cough and angioedema is seen, nothing more dangerous side effect is seen. Suitable also, these are more suitable because these also decrease the morbidity and mortality in the patients. Plus, these are renoprotective in nature. In diabetic patients, these are very useful, these ACE inhibitors. These are renoprotective in nature. So, these are used in the diabetic disease also. Cost is also fine. That is, it is less costly. Beta blockers, on the other hand, it is less efficacious because it decreases only ACE inhibitors. They were causing vasodilatation, but these beta blockers, they cause decrease in heart rate and decrease in cardiac contractility mode, decrease in cardiac output. And safety-wise also, these are less safer because they cause hypoglycemia, hypertriglyceridemia, hyperlipidemia, bronchoconstriction, vasoconstriction, and less suitable because in patients suffering from bronchial asthma, these drugs they may cause the bronchospasm when given to the patients who are suffering from bronchial asthma. And cost-wise also, these are less costly. But diuretics, on the other hand, these are no longer the drug of choice because these are less efficacious. These are safer, but they cause hypokalemia, hyponatremia, and metabolic abnormalities. These are suitable, and cost-wise, these are costly. Calcium channel blockers, these can be used as, these are also efficacious, they cause vasodilatation and safer, these are much safer. Only portion hypertension is seen with calcium channel blockers, and these are less suitable because these the patient is less than 40, it is 40 years, so it is not more than 55 years. So this is less suitable as the first line drug of choice for the treatment of mild hypertension. Cost-wise also, this is costly. Choose a P drug, captopril, ramipril, and lisinopril. These are the ACE inhibitors. From these, we will choose the P drug. First of all, what is the captopril? Captopril is the drug which is shortest acting drug. It has a short duration of action. Its action lasts for 6 to 8 hours. Plus, this is less potent, and it safety-wise also, it is less safer as compared to ramipril and lisinopril. And it is costly also. Its cost is 45 rupees. And it is efficacy is same. That is, they all do the angiotensin converting enzyme inhibitors. So these also decrease, these all decrease the production of angiotensin too. But these are, this captopril is short duration of action, and plus so its action lasts for 6 to 8 hours and it is less potent. Lisinopril, on the other hand, it is having slow oral absorption, plus it also has interactions with food. So this is least used now because just having the slow oral absorption, and cost is also 35 rupees. Ramipril, which is the long duration of action it is having, it can be given once daily dosing, and it is more suitable. It is having more tissue binding also, which is more safer, more suitable, and cost is also less. It is 25 rupees. So we can say that Ramipril is the drug of choice, P drug of choice. Ramipril tablet 5 milligram tablet dosage form is given. Dose is given. Active substances Ramipril dosage form is 1 tablet OD. And duration is length of monitoring interval. Basically, in the hypertension patients, in mild hypertension patients, the follow-up period is for 2 to 3 weeks. After that, the patient is asked to come, and then we monitor the various basic endpoints, efficacy endpoints, and we know about the side effects and know about the efficacy of the drug. And then we prescribe again if it is required. Either we increase the dose or we decrease the dose. Means this is the duration of treatment, that is 2 to 3 weeks. That's all for my pre-drug exercise on mild hypertension. I hope you like this video, and if you like this video, kindly subscribe to my YouTube channel as Dr. Nitika Pharmacology Discussion. Thank you. Be happy, be healthy, be blessed. Stay safe. Thank you. Happy learning.